privileged enough to have more than 56 gynecologists in Mumbai, Navi Mumbai, Thane area, referring us patients on a regular basis for bariatric surgery, whether it is here at Asta at Mulund or it is at Khar Hinduja or Raheja Hospital. And just to tell you, we have the highest volumes in India today in unmarried females and infertile females for bariatric surgery. I can present to you such kind of data that you'll be amazed that yes, it's just in our neighborhood that this type of work was going on. We have till date not had a single mortality or any morbidity in our patients because of probably strict guidelines that we follow. 1 के बाद 2 आएगा, 2 के बाद 3, 3 के बाद 4 and 4 के बाद 5. 1 के बाद 5 हमारे यहाँ पे कभी नहीं आता है. Protocols are never budged, and any and every person, right from the receptionist to me, anyone and everyone is so protocol based, so standardized in our approach that we have hardly seen any problems coming up. So I can assure you on behalf of my team also that yes, we can definitely be a youth support to you all. We are Asta Bariatrics. We have the dual recognition, one from the International Excellence Federation, and we are a center of excellence for bariatric and metabolic surgery from Aussie. That is our parent organization. Only the second center in India, Bombay, and 11th center in entire India. So we were the 6th to get it. Now they are 11 in entire India who have got this dual recognition because we are a single specialty 50-bedded bariatric surgery center. So this is all where we are present. And if at all you need to connect with us anytime, please feel free. We'll be more than happy to connect with you all. And even if from our side, even if my anesthetist can be of any use to you all, or Bhakti can be of any help to you all, wherever you all need, do let us know. We'll be more than happy to share things with you all, because finally it is our patient who's going to get benefited. And we have all seen during this COVID times, we are treating 90% of our patients on phone. So we are really one of the selfless kind of people. We are not selfish. We are not greedy. We doctors have proven it this time. 90% of our consultations are happening online, and we would like to follow the same suit further and try to assist our fellow doctors wherever we can in the smallest manner possible, but we'll be more than happy to do it. Anything that you all would like to ask me, please feel free and ask me right now.
I have 2 questions.
Yeah, please.
So one question is supervised weight loss for certain duration a prerequisite in your case for doing a bariatric surgery, or you decide as in when according to the patient, or should we wait for a supervised weight loss before recommending them bariatric surgery? And the second question is that in these surgeries, we don't find the cause of the obesity per se. We just treat the obesity. So what about the cause of obesity and finding it and then treating ultimately the whole this thing?
So great questions, Doc. Now, supervised weight loss. Criteria for weight loss surgery is that the patient should have had attempts at weight loss. Why do we want that attempt at weight loss? Because I don't want a patient who comes to me, "Ki, doctor, take this money of yours, you operate me, and I'm not going to do anything." So till the time I don't find that the patient has taken efforts for his weight loss, I don't operate. But we should know that he has tried diet, he or she has tried exercise. But please understand, the weight loss options are not given on this basis. Weight loss options are given on the basis of BMI. Patient less than 25 BMI are normal weight. They will do diet to maintain their weight. 25 to 30 BMI, overweight, 10 or 12 kgs overweight, yes, diet and exercise. Anyone more than 30 BMI, all across the globe, the treatment option is bariatric, where there is no prerequisite that he has to have 1 year of trial, because the trial is only going to postpone the inevitable. And trial might sometimes be a deterrent or might increase complications. Now you might ask, how can a diet increase complications? If a person does diet once with one dietitian for 3 months, and he aims or she aims that yeah, 3 months I should get 20 kg weight loss, but she gets only 5 kg, she will not just stop doing diet. She will change the dietitian. she will go from one dietitian to another, from second to third and third to fourth. Now what will happen in the bargain is she will only keep trying diet which is not the right treatment for that weight. And in the process, she might start getting either diabetes or breathlessness or sleep apnea. So diet is causing complications because of delaying it. Because more than 30 BMI, that is not the prescribed line of treatment. More than 30 BMI, diet is an associate treatment, not the primary treatment. Question regarding cause. So we do, before we operate a patient, lots and lots of investigations are done. And lots of hormonal workup is done. We can't just go and operate. Every hormone which is responsible for a weight gain is found out. And when we find that that is normal, then only we proceed. So for example, hypothyroid is not a contraindication to bariatric surgery, but hypothyroidism, you have to control. So the person should not have any untreatable endocrine problems. Treatable endocrine problems is not a contraindication to surgery, but untreatable endocrine problems is a contraindication to surgery. So we do all the possible investigations before we come to a conclusion that yes, this is probably lifestyle, behavior, familial. That is the reason we should go ahead, and our 90% to 95% patients are such.
And there is no role of the leptin deficiency being a cause of obesity, so there is no solution for that or something like that.
No solution for that. Bariatric surgery again comes out to be the solution for that also, because all the hormones which are deranged before obesity is the cause of the leptin problems. So once bariatric surgery is done, we have seen 97% of the hormones come back to normal. In fact, during this COVID times, there has been a talk coming up that consider bariatric surgery to be a semi-elective or a semi-emergency surgery, because today when we are hearing that so many patients who are obese are getting hospitalized with COVID, are requiring ventilators or are dying. So a person suppose is having obstructive sleep apnea. Are you aware that once I operate the patient, within 3 weeks, the snoring and the sleep machine which he was using can be thrown off. Within 3 weeks, 97% of our patients are normoglycemic. So this is reducing the comorbidities at a very fast pace, which will directly or indirectly help the patient increase his immunity.
Okay.
Yeah, Dr. Jyoti, you also had a pen in your hand, so I'm sure you wanted to ask something more.
What exactly happens after bariatric surgery? How does the physiology changes? I've heard that essential nutrient absorption is affected. This happens, that happens. A lot of, negative side effects. So I would just like you to brief on what exactly happens in the physiology and how does that aid in weight loss? I want to know about it.
Some part of it I would answer, some part of it I will give Bhakti also to answer. But initially we have to understand what are the types of bariatric surgeries.
Yeah.
There are basically two types of surgeries.
Okay.
Either restrictive surgeries or restrictive and malabsorptive surgeries. Now, restrictive surgeries are surgeries like band, balloon. Of course, band is now no more in use because failed over a period of time. So the restrictive surgery that we do now is only sleeve gastrectomy, which all over the world is 70% of the patients are sleeve gastrectomy. Where it is restrictive and malabsorptive, there are two most commonest type of surgeries. One is gastric bypass and one is mini gastric bypass. Apart from that, we have got 10 more surgeries that we do, but the commonest surgeries are sleeve, mini gastric bypass and gastric bypass. Now, any patient who is unmarried or married and infertile, I will not do a malabsorptive procedure because I want that patient to conceive without any nutritional deficiencies. So criteria are very clear. Even if the patient is a diabetic with metabolic problems, but unmarried or married and infertile, I will give the patient only a restrictive option. Once it's a restrictive option, then your quantity of intake is decreased at one time, but the overall calorie intake per entire day is good enough to match your routine requirements. So here, because there is no malabsorption, there is not much of nutritional deficiencies which are seen, though we keep a very strong check on 3 months, 6 months, 9 months and 12 months and then once a year on various vitamins and protein levels to ensure that if at all there is any deficiency anywhere, we will take care of that. That is the place where also the role of gynecologist or the person who is associated with whom we have associated comes up, because we give you all the entire protocol about how we move ahead. Now to the people who are having metabolic syndromes, who are higher age, taking 20, 30, 40 medicines a day, taking insulin, where we go ahead with either a gastric bypass or a mini gastric bypass, where there is one restrictive element, but along with the restrictive element, you also have a malabsorptive quotient. So there, आप कम खाओगे और जो खाओगे वो भी full absorb नहीं होगा. So that is a place where we know that the patient needs to take vitamin B12, multivitamins, and vitamin D3 regularly. But you look at the bargain, no? Here you are taking 30 medicines a day with insulin. You leave all those things and you are coming back to just vitamins and proteins a day. It is always advisable. Plus what you get is health, your breathlessness goes down, your overall comfortable, your overall life expectancy increases, your age decreases by 10-15 years. You are more active, more agile, your breathlessness goes off, your sleep apnea goes off, you are leading a better quality of life. So those are the places where this bargain definitely helps. So we choose our patients very well, which patient needs to do what type of a procedure. And for example, mini gastric bypass, here I have a patient, and we've got thousands of patients like this who have been uncontrolled diabetics, like 300, 350. Even after taking around 100, 150 units of insulin a day, we operated them for a gastric bypass or a mini gastric bypass. And it is 5 years, 7 years, 10 years now that they hardly know what is diabetes or might be taking a single tablet or so. So this is a success rate in diabetes, hypertension, sleep apnea, more than 95 to 97% of patients. Now, Bhakti, for anything else that she wants to know from physiology point of view, from diet point of view, would you like to say something?
Sure. Like post-bariatric surgery, definitely we have a certain diet protocol which we follow, because of course there's a stapling involved, and it's like a completely new stomach which has been modified for them. So there's a certain diet protocol which needs to be followed, which is like a liquid diet, and then curate, soft, full diet. This is the diet phases that we follow, and the phases differ from anywhere between 1 week to 3 weeks, depending on how the surgery is done, what surgery is done, and what is required by the patient. So in this, we see that each and every nutrient and each and every protein, like micronutrient and macronutrient, is met at every stage. Even if they are following a liquid diet, each and every nutrient is met at the initial stage itself, because we want weight loss in a healthier way and not with any deficiencies, which is what Sir said. Slowly and steadily, they start losing weight. So I would say bariatric surgery is the weight loss after bariatric surgery is kind of a natural process of weight loss. Bariatric surgery is playing a catalyst in the weight loss. That is what I would say.
And from the point of view, suppose we decide that for any person, any normal person, we should be taking around 1400 calories a day or 1200 calories a day. So here too, we give the patient that amount of calories, but it is in divided times. So bariatric surgery helps not just by reducing the intake, but it also helps in metabolic changes, bringing lots of physiological changes in the body to get weight loss. Now, I would just like to show you one thing. Bhakti, is it one thing? I would like to share something with you all, which will be really helpful for, you know, what kind of care do we take for the patients. So, लोगों को ऐसे लगता है कि आज bariatric surgery करवा ली तो हमारा खाना पीना बंद हो गया and we won't be able to eat anything. I'll just show you something as a demonstration, and Bhakti, you will have to send them the link to which you can pass on to your patients. I'll just show you something. So we have prepared a recipe booklet called as, the name of the booklet is Love at First Sight. Can you all see this? So
Yes.
now the name of the booklet, this is trademark registered with us. This is Love at First Bite is the name of our recipe booklet. And this booklet is the hard work of all my nutritionists. They've played a huge role. Our nutritionist, one of the instrumental ones who has done a lot of work, and now these people are taking it forward. So this booklet, it is not a downloadable one, so they will be sending you the link of this. So ours is a COE, IEF and a NABH hospital. Now, for example, liquid diet. So person will feel मुझे liquid diet में क्या लूँ? So you have got 50 options for liquid diet over here. Possibly you have never heard 90% of them, but they are all are calorie conscious diets. So much good in taste that you will feel that why didn't I get operated a year back or 5 years back? This is what patient will think. So look at the type of diet, and this is exactly what we allow them. Now this is just liquid diet. I will go to pureed diet. 1 second. So this is pureed diet, and soft diet further on. And we concentrate so much on diet because we want to help the patient out. We just don't want to operate and leave. Our patients since past 16 years still are in touch with us because we have been supporting them in this method. So we socho, if someone gets this kind of a support of recipes, won't even say that yes, why didn't I get it done before? Because you are allowed all these things. Now, not just this, we just finished a recipe contest and our nutritionist Sneha was the person responsible for that. We had 133 participants in the recipe contest. Out of the first 20 participants, recipes we have allowed them to get that recipe come in this recipe book also. We have just launched this book now. Though the work was going on since a long time. So this is dips and salsas.
Lovely.
And not just this, you will this was contest and award winning recipes from Food Champ, which my contest just got over in the first week of April. So we utilize this time, and these are the recipes which have been made by common people, laymen, and the first 20 have come here.
Very nice.
And apart from this, when you go out, it is not a big no to you when you go out to eat. You are allowed to eat outside. We want to even give you guidelines as to what you should eat out. So, of course, where is the outside eating one, Bhakti?
It's in this only. इसके पीछे है.
इसके पीछे है? Okay. So this is, friends, our media presence. We are lucky enough to have more than 600 newspaper appearances. Not even a single paid article, all earned articles in newspapers. Because we are a high volume center, we can have all types of cases. 11 from a family, 17 from a family, brother gifting bariatric surgery to a sister on Raksha Bandhan. We have patients who have got operated even by chiropractic. So now love eating outside, restaurant guidelines also. And we have got what type of foods that you can eat outside as starter, in salads, what you can eat. So overall, the support to the patient is such, that is the reason possibly we've had such tremendous success rate over a period of time. So we also, ये तो अभी हर एक hospital में होगा, Cure also has this surgery with EMIs. So we'll be sending you all the link. Bhakti, you will be able to do it today itself. Yeah.
Yes, sir.
So make a small letter in which your guidelines, Dr. Bhavesh's guidelines, and this link of this should all go together.
Yes.
So I feel this could be what we could do from our end. Anyone else has got any other thing to ask? Please feel free.
Dr. Manish, one more question. Does metabolism reduce with age? Like you very well said that the BMI of more than 30 need to get operated. So I would say more than 50% of women in my age group between 40 and 50 would have a BMI of more than 30. So does metabolism play a role? Menopause play a role in obesity? What do you have to say on this?
Menopause definitely plays a role. This is a hormonal cascade which comes up.
Absolutely.
And hormones definitely have a role to play. Metabolism does have a role to play. Your BMR going down does have a real role to play. And that is the reason our majority of the patients are in the age group of 40 and above also. And that is the reason this is one of the most envious branches for every person around. Just and bariatric surgery can tremendously good quality of life, extraordinary confidence, personality, and it's just a win-win-win-win situation. We've hardly over so many years, we have gifted a kidney to a patient. We've operated almost 17 to 18 patients where the patient had a renal transplant done and the transplanted kidney was also going bad. And we did a bariatric surgery for that patient to save the transplanted kidney. Diabetes came under control, kidney got saved because the microcirculation to the kidney increased, renal microcirculation increased. So these are absolutely life-saving and life-changing surgeries, no doubts. And हमें लगता है कि there should not be a person who is more than 30 BMI who deserves a better quality of life, and just because of certain mental impacts or because not having proper knowledge about it, not going for it. Reason that the patient has come to us, we can give them that satisfaction if 2 branches and 3 branches join hands together.
Okay.
So thank you so much. Thank you so much, each one of you, for taking out this 1 hour and 25 minutes. It's been a nice long talk. I thought 1 घंटे में हो जाएगा, but you know, all sorts of interesting topics kept coming on. So thank you so much for your presence here. I really loved every bit of it. Hope it was of some use to you.
Yes, absolutely. Absolutely. Very enlightening.
We can have more like these. Having more like this.
Absolute pleasure. Thank you so much.
Yes,
Thank you so much.
Thank you, Tanushree, for coordinating. Tanushree, you were fantastic. You've been connecting with the doctors so well. Thank you so much. And Bhakti Sneha, thank you again for your involvement and participation also.
Thank you.
Thank you,
Bhakti.
friends.
Yeah. Thank you, sir.
Thank you. Bye.
Bye bye.